Doctor, my father has gallstones and eats tons of meat, dairy, and bread. Whoops. Well, those are the three no-nos. These are the three huge no-nos. Meat, obviously, but I'm going to lump all protein there. I really am. And protein as a dominant source of the food, like beans. Things that are dormant, proteins, beans and grains. Dormant, enzyme inhibitors are high phytic acids, they're not germinated, they're too complex for the human body. So they're very hard to digest. And of course the high sulfur content of beans always makes them gassy and everything. So not a really desired experience with them. Makes you feel full, fat, bloaty, gassy. I don't see where anybody would think that's cool. Yes, you can soak them, but is that really what you want to do, is eat a food that you have to soak the hell out of before you eat it? I don't think so. Pick, break, good. Oh. Now, getting the gallstones out, the thing is, I don't know what condition his liver is. If he had a blood work lately, the liver enzymes were normal and every alkaline phosphatase was good and everything looked good, then you could do a liver gallbladder flush on him. But to say that, to take a man or a woman and do a liver gallbladder flush with a diet like this, I like to give them a month of raw, a month of at least 80% raw, of salads and a lot of fruits, the liver gallbladder formula. There's an alkaline phosphatase we sell here. Not alkaline phosphatase, excuse me, long morning. It's phosphate liquid. And this phosphate is a phosphorus, but phosphate liquid, and it's supposed to break up gallstones. And so we've had success doing that before we do a liver gallbladder flush to help kind of dissolve things up. One of the companies, who is that? Standard Process puts that one out. Is this related to gallstones and what can to prevent them? Acidosis is related to all forms of all stones. Anytime fluids become acidic, coagulation ends up becoming the end result. Dehydration and coagulation. And so this is why always in an acidic medium you see the withdrawal of calcium and you get calcifications or calcium stones, or you can get the biocholesterol stones in the gallbladder and liver, by the way. The liver can house stones just like the gallbladder. Done plenty of liver gallbladder flushes without gallbladders and got plenty of stones out before. So anyway, it's something you want to do. Papa better get his diet changed because he's eating the three no-nos. The dairy is at the top of the no-nos, fills all the body full of mucus and just nasty stuff. Meat is, you can live on a little bit of that once in a while with a salad and stuff. It's not going to kill you, but you would really want to detox first, get your kidneys fixed up and that sort of thing, and then go back to a little fish or chicken maybe. Breads or grains, definitely polysaccharides, starches. No way, Jose. Even whole grains. I thought all this was healthy, and I'd been a fruitarian, and when I opened up my first health food stores, I got pretty sick eating whole foods, eating grains and lots of nuts. I thought, oh, this is all raw whole grains. I thought like Dr. Jensen did for a while. Then I sort of realized that nope. I got to get back to my fruits. And so you'll find that yourselves. If you push yourself down the road and you get yourself well, you'll see what I mean. Sometimes you have to bring yourself back, and it isn't fun going back to a little bit of Hellville. But the state of balance, I guess. But get your dad cleaned up, man. You can get your dad cleaned up quite well here. If not, he could lose that. And you should never lose your gallbladder because of stones. Those are easy to clean out of the body. But you don't want to do a liver gallbladder flush when you have high elevated liver enzymes. You don't want to do anything like that because you have a lot of inflammation, and the liver gallbladder flush is spasming the liver a little bit. You don't want to do that. You want to kind of get all that inflammation out first, because going on a raw diet and going on liver herbs, liver gallbladder formula bars and stuff, it'll reduce the stones and pull them out. Just that alone will do that. Okay, gallstones on a preemie. Whoa. Hi, I have a daughter which is 1 year old, and she has gallstones since she was in the hospital as a preemie. Gallstones develop, I think, because the IV what she had there was she spent the first 75 days in NICU. I do administer to her Uridology for the past 10 months. Please let me know if there is anything that I can do to help her. God bless you. Well, she's 1 year old now, right? Okay, so 1 year old. I would take her off of all dairy products. If you're breastfeeding, stop. Get her on a fruit diet. It's time. 1 year old, it's more than time. So start her on a fruit diet, fruit and berries, and some melons. This will start breaking up, hydrating and breaking up interstitially those things that are getting hard. And for stones like this, can't do a liver gallbladder flush on a 1 year old, but you can give them the liver gallbladder formula, which also helps to purge the stones. Fruit diets dissolve, and anytime you move the body from an acid condition to a base condition, and for an infant to have gallstones shows how acidic your infant is. That's what I would be worried about. The formation of stones, tumors, cysts, this is all done under the acid sky. So, yeah, problem. So we need to get that baby in an alkaline stance, which then will dissolve those things that are hard, including gallstones. And then she'll purge whatever out of there. But I would do that. I'd get her on a little herbal program for the kidneys, the adrenals, the lymph system, because this is where you're going to look at this. And get her alkalized and get these stones out of her, Lee. That's the only way. You could do a liver gallbladder flush on a little one. But it also shows that liver gallbladder is vulnerable to become fatty and all kinds of problems. You're talking about dissolving gallstones. Yeah, gallstones are soft stones. They're yellow and green. The green is bile, the yellow is cholesterol, so they're actually cholesterol bile stones. Yeah, that's why I think it's better to use the liver formula to detoxify your body for a while, because remember, detoxification is a cationic experience, meaning it's going to dissolve away, break apart, and that's true in the blood. You'll see your blood cells. Generally, when you eat proteins and things, your blood cells cluster or follow each other like choo-choo trains. Once you're bringing in enzymatic-rich foods like fruits and berries, the blood cells separate. Everybody's good. You can clot when you need to. I know they give you anti-clotting medications and stuff in strokes and things, and really the problem is your blood is too many proteins and things in the blood. It comes back to proteins. I'm sorry. You study this and study this, you'll wonder why man has such a fetish with proteins, but look at him. He's going down. So don't be afraid of that. And then do a liver gallbladder flush, in a couple of months if you feel good about it, But detoxify for a while, and it'll pull the gallstones and polyps out and stuff like that. You might have to get aggressive with your lymph system. And getting aggressive is more fruits, more berries, and more melons. Don't tell anybody, but some of your comments, if you noticed, if you're reading some of these comments, guys, you see some of these guys have found out already how more powerful fruits and berries and melons are over vegetables. I love those comments because this is what I found. And this is what Arnold Ehret found. And this is what hundreds of great, even medical doctors found in the early 1800s, later 1800s, early 1900s, found the same thing. Everybody finds the same thing when they do it. Someone asked me about gallbladder polyps and gallstones. I tell you, you want to go on a raw food diet, which you probably are. I do a fruit fast, maybe a grape fast for a few days. Use a liver gallbladder formula. Ours will do well. I have a whole bunch of picture of gallstones here. But we have a liver gallbladder flush. You can call into the office here and get it. But it's 8 ounces of pure cold pressed extra virgin olive oil, organic olive oil, 8 ounces. And then we mix it with like 6 to 8 ounces. And I like the pink grapefruit juice. The lemons tend to be more nauseating. Oil is very nauseating, and I'd have a little apple juice. I used to take a little apple and just kind of just suck on it and chew it a little bit. Apples is a good detoxifier anyway, and we'll have the instructions for you. You can call in and do a liver gallbladder flush. I'd first get myself raw, clean the bowels. I like to put a bowel formula on here with it because you don't want to be constipated doing a liver gallbladder flush. Now, gallstones are real soft. They're generally emerald green and yellow. The yellow's cholesterol. and clean that out. But if you're having polyps, just like bowel polyps, polyps comes from the inside of the wall. It pushes through. It's like it's stagnant lymph. And so it's your lymph system again. And of course, when fluids are acidic, it creates an anionic environment, which is an environment of coagulation and dehydration, creating a drying up or a coagulating issue where things are sticking together, becoming stones or rocks or gallstones, things like this. It makes that lymph system thick, and you've gotten some real thick mucus out of the head before. Sometimes it takes months and months to start making that anionic environment a cationic environment, one where you're seeing more of a rehydration and a thinning of that fluid so the body can expectorate it better. So don't get frustrated. Some people have real bad, especially if you've been on dairy products all your lives, you could have a lot of work ahead of yourself, but don't get frustrated. You'll get it.